When I'm ear candling, is the ear that's being candled facing the floor or facing the ceiling?
Yeah, facing the ceiling. So like the person is leaning over, right. They've got it in their ear. Typically they have some sort of like plate around it.
Okay.
And then light it from the top and it burns down.
But wouldn't gravity be a good indicator that wax isn't going to go anywhere?
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
With the smell of tequila still in the air as we welcome you to a brand new episode of Ask an Audiologist, I am Kevin Ziener.
I'm Dr. Jordan.
Dr. Jordan, do you celebrate Cinco de Mayo? Well, let me say this. Living in Louisiana, I know you take every occasion to celebrate absolutely everything.
Everything.
So let me just assume that you celebrate Cinco de Mayo.
Absolutely.
Even if it falls on a Sunday.
Oh, yeah.
Okay, yeah. Perfect. Well, I knew that was going to be a layup.
Of course.
Got it. Let's talk about something that might help your hearing as opposed to hurt your liver. From Dr. Deanne Rudden of Longmont Hearing and Tinnitus in Longmont, Colorado, we are going to chat today about ear candling and its potential effect on tinnitus. So Dr. Jordan, remind us a little bit about what tinnitus is, and then let's kind of dive into how ear candling can help or hurt it.
Yeah. So tinnitus is basically a subjective sound that only that person can hear that's inside the head. That sometimes it's like a buzzing, a humming, a high-pitched noise. Everybody kind of hears that a little bit differently, but that's tinnitus. And then on the other side of that, the ear candling is this, I guess, up and coming thing that people are starting to do, or I guess they have been doing it for a little bit longer, but where people are putting a candle down into the ear with the thought process of it's going to create a vacuum and suction out any wax that may be down in the ear.
So like tinnitus can be caused by a sudden exposure to a loud noise or age-related hearing loss or a head injury or, TMJ, stress, ototoxic, all that kind of stuff, right?
Good job, Kev. Good job.
I have a list. But nobody necessarily knows where it comes from. There's just things that could potentially be linked to it.
Correct.
And a lot of people's workaround for that is the belief that putting a candle into or around your ear is somehow magically or mystically going to suck out whatever the cause of that tinnitus is.
Yes.
I mean, I would like for you to put like a professional doctoral spin on that, but I don't know.
That's hard to do. Yeah. That is hard to I can't, I have a hard time rationalizing that.
Got it.
Fire in ear.
Sure.
No thanks.
So let me just read this. So I'm not going to let your AUD degree lead us down this path because I want people to know that you have trained as an audiologist. You went to school for this. And now here's what ear candling is. Sure. Ear candling is a holistic therapy usually performed by beauticians, alternative therapists, or patients at home using ear candling kits. Ear candling is said to remove earwax buildup, helping alleviate sinus pressure, cure ear infections, and potentially relieve tinnitus. So like, what is the actual logistics of the candle in our ear? Like, what is it physically doing or not doing?
Well, I was about to say, it doesn't actually do anything.
Sure.
But the thought process behind it is that it's going to create this vacuum and suck the wax out of your ear into the kind of the empty core of this specific candle. Sure. And then the other, I guess, kind of approach to that is that they think, well, it's going to get hot enough in order to melt the wax inside of your ear to then draw it out that way.
When I'm ear candling, is the ear that's being candled facing the floor or facing the ceiling?
Yeah, facing the ceiling. So like the person is leaning over, right. They've got it in their ear. Typically they have some sort of like plate around it. Okay. And then light it from the top and it burns down.
But wouldn't gravity be a good indicator that wax isn't going to go anywhere because your head is tilted up? If the earwax melts, theoretically, it's just going to stay where it is, no?
Yes.
Yep. I mean, that's just physics.
Yeah, exactly.
Okay.
Yeah.
I don't mean to poo-poo this for people who believe it. I'm just saying, like, I have yet to hear anything in our brief conversation that would lead me to believe that it's doing anything that Curette couldn't do.
Right. Well, and I mean, they've done some research on this, and there was no research that I've been able to find that has shown any type of indication that this was helpful.
Sure. Do you think it makes it worse?
It potentially can. I mean, there are horror stories that I have heard of people doing this and then the wax from the candle melting down into the ear canal, and it's extremely traumatic.
Well, I mean, the dangers, and there's a piece of this article that says the dangers behind ear candles. 1, burns to the face, outer ear, eardrum, and inner ear.
Oof.
Candle wax falling into the ear and causing a plug or inner ear damage, which is now doing the exact opposite of what it's trying to do. Damage to the eardrum, which if you've ever had hot wax on your fingers, now imagine that on something that's never meant to be touched by anything.
Yeah.
And of course, if something bad like that happens, hearing loss or potentially tinnitus.
Mm-hmm.
So the thing, and again, when we think back to our allergies episode, some allergy medication can cause or heighten tinnitus. Mm-hmm. And now we're talking about candle wax potentially causing hearing loss and tinnitus.
Yeah, it's just safe to say, just don't do it.
Got it.
If you think that you have wax, then go see your audiologist, your ENT, your primary care. Go see someone, have them check your ears, do an otoscopic examination, and have them check your ears and see if you have wax. If you have wax, then there's so many different ways that we can remove wax, and the consistency of the wax is normally kind of what determines how we remove it.
Yeah. And I'm going to go out on a limb here and says one of the ways you don't remove wax is by heating it up and pouring it out of an individual's ear.
That's a good assumption.
Okay. Yeah, I just haven't seen that. I don't want to diminish anybody who does do that, but I've been in many clinics all across the country, and I've yet to see somebody take a lighter to somebody's ear and be like, don't worry, we're going to melt it out.
Yeah. Yeah.
So
good assumption.
What should somebody do who is suffering from tinnitus? What should their first thing be?
Go see your audiologist.
Okay.
Absolutely. Go get a baseline hearing test.
Mm-hmm.
Oftentimes, if you call an audiology clinic and you tell them that you have tinnitus, we're going to kind of put you through the typical appointment just to kind of assess and triage kind of where we are, how long the tinnitus has been going on, and do we need to dive into it deeper? Do we have hearing loss? Kind of what's the cause, and kind of triage from there.
Got it. So speaking of just, I don't know, out of left field treatments, is there something else you have heard of or seen of in your time where you're like, I cannot believe somebody thought that was a viable option?
You mean other than
other than using, like, I don't know, because you live in Louisiana, please don't take this anyway. Like, so I was like, well, no, I put a cockroach in my ear to be able to eat the wax.
No, thank God. No,
Okay.
I've never heard that. Thank God. No, no.
But anything else like, oh, well, no, I just thought if I, went into the Mississippi, the natural debris would clean out my hearing.
No, I don't think so. I think, honestly, I've heard some terrible stories about ear candling, and it's just, that's terrible. Oh, I do have one.
There it is.
I have one.
Yeah.
Well, it wasn't for wax or for tinnitus, but it was actually for an ear infection.
Okay.
This is so bizarre. I actually had somebody tell me that they put warm urine down into the ear canal.
So many questions. First off,
yeah,
whose urine?
Their own.
Okay. And
which, I mean, I don't know if that makes it any better.
What was it about urine, warm urine, that they thought was going to do the trick?
I cannot give an answer to that. I think it was like an old wives' tale type of thing.
Sure, a very old wives' tale that not many people told.
Yeah, yeah. I mean, they didn't tell me that it worked.
Yeah. I mean, we on this podcast tell you not to put Q-tips in your ear, a thing that people universally believe goes in your ear, but on the box it says, do not put in your ear. If you're not supposed to put the things in your ear that you think you're supposed to put in your ear, don't put urine in your ear.
Don't do that.
Don't put hot candle wax in your ear. What's the rule? If you can't fit your elbow in your ear, don't put it in your ear.
That's right.
Unbelievable. I hope we say, listen, I'm not going to poo-poo on the holistic approach to life. I definitely see some benefits 1,000,000% than I do them myself. Mm-hmm. I fail to see in any way whatsoever how using a candle to melt your earwax is beneficial in any way.
Yeah. I mean, really more than anything, if you're going to try to do something like from home to remove the earwax, there's a couple things that are over the counter, like, a couple different like wax softening drops, that type of thing. I've even told patients use a little bit of like baby oil or like mineral oil.
Just loosen it up.
And just soften it up. Yeah. The skin in our ear canal grows from the inside out. So it should naturally migrate out of the ear.
Got it.
If you're using like hearing aids or if you're using like earplugs often, then it's probably not going to work its way out and you may have to have it removed.
Okay.
I mean, that if you're going to try something from home, you can try to do that only if you don't have like a history of ear surgery or if you know that you have a perforated eardrum or a hole in the eardrum. Definitely don't do that.
Got it.
Any type of like ear pain.
Noted.
And just go see someone. But otherwise, maybe not ear candling.
Don't do that. Don't do it. And because we have properly scolded you into never putting things in your ears without a trained professional, please be sure to visit us at askanaudiologist.com. Dr. Jordan, a perfect job today. And now you can have that margarita that's been sitting just off screen the entire time.
Yes.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
I have patients come back and go, they're just not working. These things are junk. They've never worked for me from day one. What they don't know is that we can pull data logging on the hearing aids.
And see if they've actually been used?
Yeah.
Wow.
You can't trick me.
They're ratting out the patient.
And there ain't no stitches.
He's like, it hasn't worked for 2 weeks. Is that why it hasn't been turned on for 2 weeks?
Yeah.